The Your HSA eligible plan conforms to the IRS high deductible plan requirements, which allows you to contribute to a health savings account. One of the requirements is that you will pay the full negotiated rate for both medical services and prescription drugs prior to meeting your Tier 1 deductible. If you have single coverage, your annual Tier 1 deductible is $1,300, or if you are covering one or more dependents, for example a spouse or domestic partner, and or one or more children, your annual Tier 1 deductible is $2,600. Throughout the year, all of your out-of-pocket medical and pharmacy expenses covered under the Your HSA eligible plan will count towards your deductible and out-of-pocket maximum. Once you have met your Tier 1 deductible, the prescription drug coverage benefit will apply. For generic drugs, you would pay a $10 copay for a 30-day supply. For a preferred brand drug, you would either pay 20% coinsurance or a $25 minimum or $50 maximum copay. For a non-preferred brand drug, you would either pay 35% coinsurance or a $45 minimum or $90 maximum copay. If you meet your Tier 1 out-of-pocket maximum, eligible prescription drug expenses will be covered at 100% for the remainder of the plan year. Example 1 is a prescription cost prior to meeting the deductible. The drug atorvastatin is a generic drug. The negotiated pharmacy retail rate for a 30-day supply is about $65.79. Assuming you have not had any medical or pharmacy claims to date in 2015, you've paid $0 towards your deductible. Therefore, you have $1,300 remaining on your deductible if you are enrolled with single coverage, or $2,600 remaining on your deductible if you have one or more covered dependents. Because you have not met your deductible for the year, your out-of-pocket expense at the pharmacy would be the full cost of the drug, the pharmacy's negotiated rate, which is about $65.79. Once you've paid for your prescription, you will have $1,234.21 remaining on your deductible if you have single coverage, or $2,534.21 if you are covering one or more dependents. Example 2 is also a prescription cost example prior to meeting the deductible. The drug clopidogrel is a generic drug. The negotiated rate for a 90-day supply is about $172.45 through mail order. Assuming you've had some out-of-pocket medical and or pharmacy claims expenses to date in 2015, and you've paid $600 towards your deductible, therefore, you have $700 remaining on your deductible if you are enrolled with single coverage, or $2,000 remaining on your deductible if you have one or more covered dependents. Because you have not met your deductible for the year, your out-of-pocket mail-order pharmacy expense would be the full cost of the drug, about $172.45. Once you paid for your prescription, you would then have $527.55 remaining on your deductible if you have single coverage, or $1,827.55 if you are covering one or more dependents. Example 3 is a prescription cost example after meeting the deductible. Symbicort is a preferred brand drug. The negotiated rate for a 30-day supply is about $202.97. Assuming you've had out-of-pocket medical and or pharmacy claims expenses in excess of $1,300 if you have single coverage, or $2,600 if covering one or more dependents to date in 2015, and you've met your annual deductible, your prescription drug benefits under the plan will apply. As Symbicort is a preferred brand drug, you would pay 20% coinsurance, which would be $40.59. Your out-of-pocket prescription drug copays or coinsurance will continue to be applied to your annual out-of-pocket maximum after you've met your deductible. Example 4 is a prescription cost example after meeting the deductible. Metoprolol is a generic drug. The negotiated rate for a 30-day supply is about $31.47. Assuming you've had out-of-pocket medical or pharmacy claims expenses in excess of $1,300 if you have single coverage, or $2,600 if you are covering one or more dependents to date in 2015, and you've met your annual deductible, your prescription drug benefits will apply. Your out-of-pocket cost at the pharmacy will be subject to the applicable copay or coinsurance. As metoprolol is a generic drug, you would pay a $10 copay. Again, your out-of-pocket pharmacy costs will continue to be applied to your out-of-pocket maximum after you've met your deductible. The URMC Employee Pharmacy offers a discount to all employees. Employees and their dependents enrolled in the Your HSA eligible plan or the Your PPO plan will receive a discount off the out-of-pocket costs of each medication. The URMC Employee Pharmacy offers free prescription delivery through a daily courier service to most off-site locations. If you have asthma, diabetes, hypertension, heart disease, or congestive heart failure and enroll in a condition management program, you may have the opportunity to receive a $10 discount off your prescription drugs to treat these conditions, or a 25% discount on coinsurance for prescription diabetic supplies and equipment under the university healthcare plans after your deductible is met. Talk to your doctor about switching to generic drugs. Some generic drugs cost less than half the price of a preferred brand drug. After your deductible is met, you may be able to take advantage of the generic trial program, which offers a free trial of selected generic medications for the first 6 months of your prescription. Several features are available to you on the Excellus Blue Cross Blue Shield and Aetna websites. You can use the Pharmacy Locator tool to find a local participating pharmacy, follow the online link to fill a prescription by mail through Walgreens Mail Service for Excellus members, or Aetna Rx home delivery for Aetna members. When you fill a 90-day prescription through mail order, you pay 2.5 times the cost of a 30-day supply. View your claims history and obtain a prescription report, which includes the prescription number, medication, physician, and pharmacy location. Search drugs and compare costs. The cost of prescription drugs varies widely, even for medications that are used to treat the same condition. You can use the Drug Cost Estimator tool to get a better idea of the cost of drugs. Aetna members can visit Aetna.com to log into the Aetna Navigator and use their subscriber ID card to create a username and set a password. Excellus members can visit excellusbcbs.com/UR and use their subscriber ID card to create a username and set a password. Contact the Benefits Office with questions about the university healthcare plans. Contact the URMC Employee Pharmacy with questions about the pharmacy location, pharmacy hours, or the courier service. Contact Aetna or Excellus directly for information about prescription drug costs, participating pharmacies, and claim history.